Welcome to A Germ's Journey Newsdesk, an international dialogue about the challenge of supporting community-relevant public health communications. Find out more about A Germ's Journey at our website, germsjourney.com, or find us on Twitter at germsjourney. Hello, welcome to A Germ's Journey Newsdesk. I'm Rob Watson, and this is the second session of our Newsdesk Day, and we're bringing together a group of practitioners, media practitioners from BBC Media Action. We're joined by Mary Morgan, who is you're based in Sierra Leone, is that correct?
Yes, I'm in Sierra Leone. So I'm the head of production and mentoring here in our Sierra Leone office. And we also have on the call Mahmoud Tarawali, who's my boss. He's the country director here in Sierra Leone. And we have Junaid, who is the country director for BBC Media Action in Ethiopia.
Okay. I'm really grateful that you're taking part of this because it kind of came together at the end, which is always really satisfying. And one of the challenges with the pandemic, and it's if you like, there's been a concentration and an acceleration of an intensification of the reasons of why we do this, but the trusted nature of, for example, the BBC World Service and the work that BBC Media Action does. Why has that been so important through the pandemic?
I guess it's partly been important, speaking from a Sierra Leone context, but I'm sure that this would resonate with the experiences of people elsewhere as well, is because there's been so much information and misinformation out there and people have not known who to trust. And I think there's a certain level of media and particularly digital media illiteracy where people don't know how to assess a piece of information and look at its source and where it's from and work out what's trustworthy and what's not. But BBC in many markets carries with it a real kind of weight and authority. It's also a big responsibility for us because when people hear something on the BBC, they kind of take that perhaps in a way that they wouldn't from elsewhere. But we've really tried to use that to connect with people and to connect with communities and to give them the information they need to guide them through what's been quite a scary time. Junaid, I don't know if that kind of sounds like how you would feel from an Ethiopia context.
Yeah, it does resonate with what we have been doing in Ethiopia. Thank you, Mary. And in response to COVID-19, BBC Media Action globally, through research, production and outreach tools and training of media and NGO partners has helped respond and understand audience need and audience understanding that particularly the recommended prevention behaviors, manage infodemics, manage the wider impacts of mis and disinformation information, and also do myth busting. So that is the same approach that we are doing and have done in the last 12 months or so in Ethiopia also.
Can we unpick this? Because I think this is a really essential set of issues, and I'd like to kind of go into it in a little bit more detail if we can and understand what the process is and what the thinking is behind the practical steps, and then think about what the kind of impact is and what difference it makes, in effect, to mitigate harm and mitigate the spread of the pandemic in its most extreme forms. So, Mary, can you just describe to us what the kind of editorial process is like that you are trained in and what you are guided by in terms of looking at a story that relates to health issues and pandemic issues?
Yeah, so actually, BBC Media Action has developed a really clear set of guidelines for initially actually communicating in health emergencies based on learnings from Ebola in West Africa, in Sierra Leone, Liberia, and Guinea a few years ago. And then it has adapted those and produced a handbook for media working on coronavirus. And I think some of the really key elements of that include the idea of giving people news that they can use, not just overwhelming them with scary facts and figures which are not going to be any use to them. And something which has been really important to the context that we're working in is the idea of giving people practical, actionable advice and steps that they can follow. So something that's been quite important for us has been translating lots of that information and advice that's been coming from WHO, CDC, some of the big global organizations, translating it not just in terms of language, but in terms of what is realistic for people living in these contexts. So one advice or one example of that might be the early advice around hand washing and the need to wash your hands under running water for 20 seconds using soap. And we knew that for a lot of people, a lot of our audience, water's quite scarce, and running water for 20 seconds and having the sort of soap that was appearing in lots of the information that was being disseminated, the kind of quite expensive liquid hand, in a dispenser kind of thing, wasn't achievable for people here. That soap was expensive. They don't have enough water to run it for 20 seconds. So, and we knew that that was a worry for our audiences. So we talked to doctors here about what can people do? Is it okay if it's not for 20 seconds? Are these other kinds of soaps that are available locally, are they going to work? What about people who are using ash to wash their hands, which people sometimes do when they don't have water? And some of those questions actually, which we were putting to experts, were questions that we sourced from communities. So that's another really important part of BBC Media Action's strategy, is connecting with communities and having a conversation around health needs and health behaviours. I guess talking with them rather than just talking at them. I'll let Junaid pick up because I'm sure there are other aspects which he'd like to mention.
Yeah, thank you, Mary. I mean, just to add to what Mary has said, as part of all our programs that we implement in each country, we focus on gathering evidences and feedback from community to understand their preferences in terms of content and medium of communication. Mary talked about one example of different options, but then our research also looks into the root causes and barriers to change on specific issues that we focus. So under our projects, we design evaluative research to assess the impact of project as well as incorporate feedback from our audience and community to evaluate the efficacy and impact of any TV or radio activities. We do a lot of quantitative and qualitative research, and if we are doing any digital media work or social media content dissemination, then we also supplement our research with digital analysis of the content. So whatever programs we basically we devise, basically it is based on the strong research that we have. Our research also guides us what are the means of communication. In Ethiopia context, majority of the people, they listen to radio, but then in different specific area, there is no coverage. If we focus on different gender aspects or also maybe age, if we take into account age factor as well, many of the youth in Ethiopia, they don't listen to radio. They basically follow social media. So, I mean, our research also helps us in coming up with content, but also the mediums through which that content can be disseminated also. So some of the recent work that we did on pandemic was mostly on social media. We talked about community. We also talked about engaging sort of, mediums of communication, be it community radios, TV channels, or disseminating our content on social media platforms. Also, we are also working with journalists and media houses in Ethiopia also, and I'm sure Mary and the same has been done and is ongoing process in different countries of where BBC Media Action is operating. We basically, whenever we partner with any media house, also we do an extensive capacity needs assessment. But at the same time, specifically to Ethiopia, around pandemic, what we did, that we also produced a series of training audio modules. These training modules focus on covering health emergencies with a specific focus on pandemic and COVID-19 and tackling mis and disinformation. Some of the topics which those modules covered were around effective communication, generating content, and understanding misinformation, and dealing with COVID-19 misinformation, rumors, and fact-checking. So our approach is basically understanding our audience, finding the best way of communicating our content to them, and then also at the same time build capacity of local media houses as well as journalists to be able to continue with the work in the long term. I hope that answers the question.
There's a number of factors with that, which is clear that the process really is well thought through with BBC Media Action. So it's based on research, it's based on evidence, and it's based on editorial processes that are open, transparent, clearly defined. And the context is a changing dynamic media ecology of lots of different elements and dimensions that have opened up. What do you think is the core factor about trust, that people can trust the messenger and the source of information? What's that? I mean, it might be, you know, I might be being very, you know, kind of naive with asking this question, but why should we trust a BBC journalist or any journalist when we live in this world of that is awash with competing, to use those phrases, truths and opinions, which, you know, we kind of, what makes facts, you know, what's the core that we protect and that we work with on that? And then we can think about the other context with that. Just, you know, what do you do as media practitioners that retains the integrity of the information that you're sharing?
I think that's one of the things that we've been trying to educate our audience about a bit. So I think in the context of coronavirus, we've been trying to, through our social media channels and through, we had a health radio program here, educate our audience about information and misinformation. And the idea of things like sourcing, so where information is from. And we found that a lot of people here didn't really know what a trusted source of information might be, actually. So helping them see what that was. In the context of Sierra Leone, that has actually been quite often reinforcing the government message that any official changes on coronavirus policy will be posted on the Ministry of Information Facebook page, because there's been an awful lot of fake press releases, doctored statistics with the daily coronavirus statistics, which circulate very quickly on WhatsApp. So pointing people towards the trusted source of national information, trusted international sources, which have actually been the WHO and BBC News kind of globally. And sharing with audiences how we know that our information is accurate. So that includes verifying things, and actually the kind of BBC rule that we would have two sources on something. You know, if we hear something here, we're not just going to share that. We would be checking with the Ministry of Information whether that's happened. And hopefully in sharing with audiences the way that we check and verify things and our thinking about sources, we hope that that might help audiences themselves, give them the skills to, when they hear something, be able to assess, is this true? Do I know it's true? Is it something that I should share?
And that's a shift, isn't it? That media literacy skills is a shift in thinking. For, you know, in the past, the name, if you like, of a large, the Associated Press or, you know, BBC Media, the BBC World Service around the world were badges of trust. But now what we're having to do is to go into that and dig into it a bit deeper and actually facilitate those information and media literacy capability to building, which is the phrase that Junaid said earlier. How does that work in practice then, in terms of, you know, what works and what doesn't work? What have you found has been successful, and what would you think you need to improve on?
Perhaps I'll let Junaid pick up on this, because I know they've also been doing a lot of work around misinformation in Ethiopia.
Thank you, Mary. Yes, specific to Ethiopia, in Ethiopia, Ethiopian government is implementing basic measures to increase awareness and is coordinating all communication outputs through assigned task forces. So BBC Media Action is working with these task force to identify existing information gaps. Tackling misinformation is a concern in a country where millions of people have limited access to information because of insufficient internet penetration, illiteracy, and language diversity. We are working in a coordinated fashion with the government to tackle misinformation, but we are also creating more in-depth content on topics such as verifying authenticity of information, or how to identify misinformation and do myth busting. So through our social media content production, we have done a lot on that. As I mentioned already, when we are providing capacity improving trainings to our media partners in Ethiopia, we have done a lot in that also. And again, I'm repeating my words, we have developed modules, training modules for journalists, which were widely disseminated in the country in different languages for journalists in Ethiopia to tackle or track and sort of identify some misinformation, disinformation, and how they can produce like authentic news. So that's how we have done it during last or during this pandemic.
And what's the kind of thing that goes down well with audiences, with viewers and listeners and users, as we now describe people? Is there have you noticed a pattern, a change in what kind of information people, you know, are happy to consume, or you know, kind of satisfied with?
Yes, I don't have exact figures, but I mean, from our research that we are doing ongoing and during our projects, and also at the end of projects, I mean, we did have like positive feedback from our audiences where they were able to track mis and disinformation, and they were able to verify. So the figures were quite sort of positive, and we use the same information for our ongoing work, and also for creating those audio modules that I'm referring to.
Because as media professionals, we can be in our we can be in our own little bubble, can't we, where we do what we think works well. We'd all like to work in a certain way, but our audiences, not the people that we're here to serve, are acting in a different way. Mary, jump in, what was you
well, I was just going to say that I guess our approach in both Ethiopia and Sierra Leone, and I know lots of the other BBC Media Action country offices, has been that we are at the same time engaging and trying to educate audiences about misinformation, but also local journalists. So Junaid mentioned the training that they'd been doing with local journalists in Ethiopia. We've had a very similar approach in Sierra Leone. We developed, it was our first ever experience of delivering remote training, because we had an inter-district lockdown here for a number of months, so we couldn't travel. So we were using, internet here is not always very good. So it was through a combination of Zoom calls, which most of our local radio partners had never used Zoom before, and WhatsApp sometimes, and sometimes sending videos and audio on WhatsApp for them to consume off the call and then come back and talk about, because we felt that capacitating local journalists, and we have a big network of local radio stations around the country, was really important, because those journalists felt like They didn't know very much about coronavirus. A lot of them have never received any journalism training. Lots of them are volunteers. So they weren't very confident themselves with how to verify information, knowing what to trust, particularly on health stories. I think lots of journalists might feel quite confident covering a breaking news event, covering politics, but if they don't have a background in health, it's something which they shy away from a little bit. But we know that for audiences here, lots of people they have a very trusting relationship with their local radio station, and that might be their main source of information. So it's really important that those local radio stations are able to confidently and accurately report on the pandemic and give their audiences the information that we need. So we've been supporting local radio stations to do that, as well as producing our own content.
And I think Mahmood is asking that our chat is contributing. It's good. We have the chat box on YouTube. If there's any questions that you want me to put to our guests, then we can do. The local differences between Sierra Leone, Ethiopia, the places where you operate, how you've hinted at that in terms of bringing, in a way, putting everybody onto Zoom calls. It's been a very interesting experience. We're able to have this conversation over Zoom. It's the Zoomification of our background processes, which brings people together, which we never kind of expected that or anticipated that we would be able to do. And there are limits to that. However, it also highlights cultural differences and local differences in need. How have you kind of liaised and communicated and supported each other to bridge some of those differences, or to kind of meet some of those challenges that the differences represent? Because the context can be very different, can't they, in some small and subtle ways, and then in big major ways.
I'll pick up and then see if Junaid has anything to add. But in terms of kind of sharing learnings and approaches and kind of comparing approaches in our contexts, we have had a lot of collaboration across the organisation. So we very quickly set up a kind of COVID team in London. We already had a health advisory team there. But set up a team that was supporting country offices. To be honest, for us at the beginning, it was really useful for us in country at the beginning. It was really useful to have that advisory team to call on. We've had very regular kind of question and answer sessions with the health advisory team sharing back with us kind of updated information, us and our teams having the opportunity to ask questions that we're not sure about. We have had some kind of centrally produced content, which has been available for country offices to adapt and translate and to pick and choose a little bit what we think is going to work for our audiences, because we're working in very different contexts. And we have been producing our own content, which meets the needs of our audiences, but always having that health advisory team to call on, if we need support and advice with that. And in terms of adapting to the different contexts, both Junaid and I have mentioned several times the importance of learning from our audiences, but that has been really important throughout kind of ongoing research. And as well as the research carried out by our research teams, that relationship that we have with our local stations has been a really important part of our learning and understanding audiences, because we get really regular feedback from them about what are the questions which people are asking them, what are the fears in their community. And it's actually allowed us to address really head on some of those myths and things that people are scared of. So several times in our health radio program, we got experts on to answer audience sourced questions. Is this true? Is this true? If you drink lots of alcohol, will you not get coronavirus? Is ginger going to stop you getting coronavirus? Is it only white people that can get coronavirus? But rather than talking in a general sense around myths and information, actually gathering those and responding to what people are saying and thinking locally, we hope has helped our response to be very much what the audience needs, what they're asking us, we have tried to answer. Junaid, does that sound kind of true of your experience?
It is. And thank you, Mary. And I think since the start of pandemic, I'll be more specific about the current pandemic context also. The country offices in Africa region, as well as throughout the world where BBC Media Action operates, we have been regularly sharing experiences with each other. I know I'm part of weekly calls where we talk about challenges, what has worked well, and we have also talked. I mean, a lot of experience and learnings were shared around different countries. I will not repeat what Mary said, but Mary did talk about some central content being produced in BBC Media Action, which I think every country office in BBC Media Action is referring to. In Ethiopia, we had a similar kind of situation. We did have a lot of content already available. We just had to modify it a little bit in light of the research that we conducted, and then also in light of our coordination with different task force in Ethiopia also. Of course, every country has its own context and constraints. Ethiopia, just like any other country, was facing a number of issues when this pandemic started, be it access restriction, be it we also, I mean, like in Ethiopia also we had issues related to political unrest, where internet remained disrupted for a very long time also. So then we had to modify. Where we could, we provided a lot of training in person to our media partners. Where it was possible, where internet connection was good, we did a lot of online remote mentoring, training, technical backstopping also. I talked about these training modules. So this was the idea, the idea which we came was in light of the internet disruption in Ethiopia. Also in many parts of Ethiopia, internet access is very limited, internet quality is not good. So we thought of coming up with content or something which can be easily shared, easily accessible. So we thought of like doing any video content. We thought it might not be easy to share. We also thought about online learning, but then we came up with the idea of coming up with like very light kind of audio content, audio training modules, which could be easily shared by emails, by WhatsApp, by Telegram. So we came up with that. But the main topics or content, general content was almost the same. We just adopted it in our current context.
The rush towards digital participation and engagement has to be tempered with reality. I don't know if you saw the report recently that Brazil is mandating that all mobile phones, smartphones, also come with an FM receiver, because clearly people in rural areas are faced with digital exclusion and poverty, and that must be the experience in Ethiopia and Sierra Leone and other places that, you know, the Western expectation that we are blanket covered by broadband and Wi-Fi is kind of a dangerous assumption for us to make, and therefore the leap towards everything becoming a digital engagement platform. What would you say, and what would you ask people to keep in mind as why we still need to support those legacy broadcast forms of radio and other forms of broadcast media in order to protect the integrity of that information ecosystem that we recognize now as being so fragile and necessary, needed? Yeah.
So may I respond, maybe, Miri? Yeah. So last year we did an interesting piece of research in Ethiopia, countrywide research, and the research basically covered like audience preferences and mediums they use in different regions, as well as through different age groups and genders also. As I told you, if you pick certain age groups, like our research basically showed us that majority of the youth in Ethiopia, they were basically looking or using social media as a platform for getting all sort of knowledge. So if you want to focus on youth in a country, of course, definite medium would be social media. But then also there are areas in Ethiopia which are like sort of media dark, which only has radio access. And if you are also focusing like mothers, parents, or contributors, other contributors in the community also, most of them don't use maybe smartphones, or they don't have access to social media. So holistically, if we want to approach everyone in a country or maybe in a region, we have to pick all sort of mediums. So not only in different programs, we opted to do social media, but side by side, we did a lot of video production also. Also, countrywide, we also know that television access is increasing. So we also came up with the idea of producing content for television also. So holistically, we try to cover everyone. In Ethiopia also, there are areas which are totally media dark, where social media access is not there, radio access is not there, television access is not there. So what we did, BBC Media Action, and I know in many countries of BBC Media Action where we are operating, we also use an approach of outreach or listening groups, or setting up listening groups, where we basically produce content, be it on like audio format or video format, and basically we then our outreach teams go in those community, and then they disseminate it through various ways, either through providing like different radio devices, or through if it's like in the form of print, we our outreach officers go and disseminate that. We have also done a lot of video screenings in the community. So if we have we did some projects around women and girls empowerment. So what we did, that we produced some video materials from that community, and we basically invited everyone in the community, religious leaders, community leaders, and basically we played those videos, and then we asked their feedback. And we basically modified the content with their feedback, and once it was formed, we disseminated it through different means in the same community also. So I would say, as much as we are moving toward using social media, and we have like digital strategies, but then we also have to keep in view that some mediums like radio, television are still viable, and in order to access the wider population, we have to use those mediums also. Sorry, Mary, I'm talking a lot.
No, it's fine. I'll just add something very short, because I think you've said a lot of what I would have said. But that, there are many people in Sierra Leone who not only don't have and can't afford a smartphone, but who live somewhere without electricity, so who can't regularly charge up that smartphone, and who cannot read. Illiteracy, particularly amongst slightly older people, is still very high in Sierra Leone. And we also have embraced a combination of social, digital and radio strategies, because we know that an awful lot of people, the only way to reach them still is through radio.
Yeah.
That's a very powerful point for us to kind of reinforce that. I think also came through from the previous conversation that we had with the colleagues in Bangladesh, was that we here in the UK still need to invest in the BBC World Service and BBC Media Action, because it plays a vital role in supporting people who are, as you say, in information deserts. One last question for each of you is there something that you've kind of drawn inspiration from or have enjoyed? I mean, I know we're talking about a pandemic experience, which is quite difficult, but I think it's always good to have a positive idea, positive reinforcements of what we do, that you've seen, or you've been involved with something where you've thought, this confirms why I do this. You don't go into the work that you're doing on the basis of you're not going to become rich, you're not going to become famous. You're doing it because you're committed to a principle and a set of values. Is there something that you've engaged with? There's something that you've come across, something that you've shared with others, that you've kind of gone, yeah, this is that point, this is why I do it? Junaid, let's start with you, and then we'll give Mary a little bit of time to think, because
yeah, I'm thinking about it also, because we have done a lot in the last year or so. I think, we have done a lot of work with migrants, refugees in Ethiopia. Also, we have done a lot of work with women. We have done a lot of wash-related work in Ethiopia also. But whenever you go to your areas or where you are working, and when you meet with your audience, when you meet with your beneficiaries, and they give you stories of how they improved through the course of this project, or what what their practices were before the project, or what positive changes happen in their life after they listen to our content, or our they were involved in our activities or whatever. That is a source of sort of motivation for us. I mean, I've been working in this sector for like almost 17 years, but the motivation that I get is from our beneficiaries, from our audience. Whenever you meet them and you see a positive change in their life, that's something that makes me believe that I should be continuing. I can talk about specific stories in Ethiopia, but I leave it to Mary. Maybe something came to her mind.
Well, I think you're right. It's that stories of change, and that's something which we're always looking for at BBC Media Action, because one of the big things we do on lots of different areas is kind of behaviour change, communication, which has been at the heart of all communication, I think, around coronavirus and trying to change people's behaviours. So it's really wonderful where we do see that change. But one thing that I've particularly enjoyed has been getting different people involved with that conversation, because one thing we hadn't mentioned about our approach, but is that we know that audiences need to hear different sorts of voices, and different members of your audience will engage with different voices. So if it is just the government, or if it is just medical experts, there are some people who will switch off or who won't trust those voices. So it's been a real joy getting different people involved with this. So there's a comedian that we've worked with on different health projects, who we've done some public service announcements with around coronavirus. There are various musicians who've recorded songs about it, who we've got on the programme and put on our social media. We have another radio programme about girls' empowerment, but we got some young girls that were like 16 or 17 to help us present a programme about the vaccination. And they went out, they talked to the adults in their community about if they'd take the vaccination, why not? Because it was mostly not. And then they went and interviewed doctors about it. So just getting everybody involved, we feel, is the way to be effective, but has also been a really fun, engaging way to work. And by the end of that programme we made with the girls, for example, they felt that they were going to go away and encourage their parents to take the vaccine because, having found out about it, they thought it was the right thing to do. And we hope that our audience, hearing their experience, what they found out, and hearing how their attitudes changed during the course of the programme, might encourage wider change amongst the people listening. So, that was a moment for me where I felt like we're making an impact, but there's been many moments.
It's really great. What resonates with me, and I think what resonates with the Germ's Journey project contributors and developers, is this idea that don't give instructions, but be a guide. And I think, kind of a trusted guide who helps you make your own mind up and find your own path, rather than saying you must do this and you must do that, because that is kind of like we all maybe turn. I know I certainly do anyway. Turn off at those kind of things. It's been fantastic having a conversation with you. We will definitely follow this up. I think there's a lot more that we can learn from your experience, and that we can bring back here into the UK, particularly to re-inform and re-engage our media curricula, the way that we train people who work in professional communications, to introduce that element of listening and engaging with your audience, not as at the end of a distant process, but as equals and at the core and heart of that process. That really resonates with me. So I'm really pleased that you've taken the time out today to have this conversation. And we'll let you get on with the rest of your day. We'll share some links, and we'll let you know when the video feed and the audio podcast are up online as well. But Junaid and Mary, for now, thank you very much, and we'll be back in contact soon.
Thank you very much for having us.
Yes.
You're welcome. You've been following A Germ's Journey, an international dialogue about the challenge of supporting community-relevant public health communications. You can find us on Twitter @germsjourney or go to our website germsjourney.com.